Thank you so much for the opportunity to be with you today in your regional dissemination meeting to advance HIV prevention options for women in Asia Pacific. I'm really so pleased to join you today to share reflections on the pathway to avert the prevention crisis. The HIV epidemic, as you well know, is one of the most significant public health endeavors that we will ever know, both the response and the epidemic itself. We have seen extraordinary success globally, but we've also seen extraordinary challenges. Despite the successes in scaling HIV life-saving treatment for people living with HIV, we are amidst an ensuing prevention crisis. There are over 1.3 million new infections globally every year, and this hasn't changed since last year. There's a prevention crisis happening around the world, and especially in Asia and the Pacific, where in your region, these new infections account for a quarter of annual new infections around the globe, around 23%, all happening in Asia and the Pacific. And between 2010 and 2023, Asia and the Pacific saw only a 13% decline in new infections, which is trailing well behind the global average decline of 39%. Women in Asia and Pacific continue to face unique challenges in accessing effective HIV prevention methods, often compounded by social, cultural, and structural barriers that make it that much more challenging to access these prevention methodologies. Current prevention options, such as oral PrEP and condoms, don't always meet the varying needs that women have. So we must diversify, we must ensure choice, and we must ensure options for prevention, and that they are available, accessible, and affordable for women in need. We at UNAIDS, the joint program, play a critical role in supporting countries and communities to accelerate HIV prevention with a science-driven, innovative, and tailored HIV prevention response. We're committed to making prevention options and methods more accessible and inclusive, ensuring that people have both the access to the prevention options and scientific technologies, but also that they are supported with the appropriate policies and enabling environments that really do link the biomedical, behavioral, and societal supports that is required. Within Asia and Pacific, there are some of the world's fastest growing epidemics, such as in the Philippines, for example, where there's such a large unmet PrEP need. There's an urgent need to expand the availability, awareness, and uptake of prevention options to turn these trajectories around, including introducing newer, scientifically backed, long-acting prevention tools like the Dapivirine Vaginal Ring. As a woman-controlled and discreet HIV prevention option, the ring has great potential to be empowering, both as an acceptable and effective additional choice for women in the Asia Pacific. I can't emphasize enough the need to expand HIV prevention choices to address the HIV prevention crisis. Choice is the way to go. The evidence is clear from studies like SEARCH that providing choices in HIV prevention, both in prevention tools and in prevention service delivery, increases overall prevention use. This is the direction we have to go. It's important to have multiple prevention options available and to empower women to choose methods that fit their personal needs and preferences. The ring offers the potential to complement other prevention strategies, especially for women in high-risk areas where we see a high increase in new infections in some subpopulations and some geographies. So really in closing, I really just want to put an emphasis for the multi-stakeholder collaboration that happens at the country level, across UN agencies, together with national health programs, across sectors of government, communities at the center, and policymakers, working together and in support of people who are in need to facilitate the ring's introduction and expansion. We need we need the collective work across all these sectors to support policies, awareness programs, and resources to overcome the barriers to the access to the Dapivirine ring. Thanks very, very much, and I wish you all great deliberations in this regional dissemination meeting. Thanks so much.